Hey, if you're dealing with a pulled back muscle, let's start getting it fixed today. If you stick around to the end of the video, then we'll go through the background, the why behind it, but let's go ahead and get it fixed. First thing we need to do is loosen up the glutes. So we're gonna do, as I'm gonna lay down on this table, and I'm gonna put this lacrosse ball off to the side of my glute. So it's right where my belt loop is right here. So I need to loosen this up. This is a corkscrew. Think about my clothes if I was wearing a onesie. You could just imagine that. Wearing a onesie, and we got a corkscrew right here. It's pulling both directions. This is where a lot of muscles overlap, so they get stuck together. So what I'm gonna do is I'm gonna put this right in my belt loop, in between my hip bone and my pelvis right here, right in the middle, and then about an inch back. And now I'm gonna take my knees and my shoulders, I'm gonna roll into it. And it doesn't feel good. We're digging out muscles that are overlapping. So I'm gonna rest right here. The most movement that I want you to do is just allow that leg to come in and out. Just kind of gliding it, if that's tolerated well. You can just kind of sit like this. If I roll over more, it's more intense. If I roll back, it's less intense. So I'm finding 2 spots. I'm gonna do it for 30 seconds in each spot. So it's a total of a minute, loosening up each glute. So I'm right here. Now I'm just going to adjust my body down a little bit right here, and I get to a second spot. Now it's pretty tender. So I'm finding tender spots and loosening them up. And then as it gets easier, you're breaking up the superficial layers. As it gets easier, now I start kind of gliding that leg. After you've been doing it for a couple months, it starts to get where, oh, I'm not really feeling much. And then you might want to take this leg up, put it on the other leg, and then we roll into it. Now I've created tension through the muscle, and I can dig into it and find those spots. What I don't want you to do, I want to make sure that you don't wiggle in your back. If we're wiggling through our back, then any pulled back muscle, whether it's through the lumbar spine and the thoracic spine, where that wiggling isn't productive for us, especially the lumbar spine. But this pulled back muscle fix is going for the lumbar spine and the upper back. So we got to hit both of them. We're doing the full back. Pulled muscle, we're going to loosen all the tissue up so we can get it to glide. Let's get into number 2. Number 2, we need to loosen up our biggest hip flexor in the body. It's called the psoas. So I'm going to lay down, and then I'm going to find my pelvis right here. Just look for that bone. I'm going to find the pelvis, and then I'm going to put my stick, anything. You can use a rolling pin, a dough roller at home, or a broomstick. But I have this massage roller, so I'm getting right inside the pelvis, and I'm pushing down and out. And so at the end of the video, I'll show you exactly what the muscle looks like. But right now, we're just loosening that up. So I do a little bit of a glide, and I'm doing this one for a minute, loosening up that muscle. So now I've loosened up. This muscle is connected directly on the spine. So loosening it up is going to take a lot of pressure off the muscles in the back. So it's the connection to the spine on the front, and then the pulled muscles in the back. So we loosen up the front side, we loosen up the back side around the pelvis and around the hips right here with these 2. So we do a minute on this side and a minute on the other side. That's an area that most times people haven't had worked on at all. And so it's gonna be tender. We wanna be gentle. We wanna be at a 3 or a 4, like pain level. We want to be uncomfortable, but tolerable when you're doing it at home. Let's get into number 3. Number 3 is thoracic mobility. We got to be able to move through our thoracic spine. And that might be a little bit tender right now, so we want to be gentle with this. With the thoracic mobility, I'd get closer to a 2 or a 3. So what we're going to use is a double lacrosse balls. It's called a massage ball peanut. And so we lay down right here. You can also use a towel roll, like a sweat towel. If you just roll it up into a cylinder, then you can lay on that if you're at home and you don't have one of these. So I'm gonna lay back, and with our skeleton right here, you can see I'm gonna be just below the shoulder blades, right at the base of the shoulder blades, and then about mid shoulder blade. Those are my 3 spots. So I'm gonna lay this down, I'm gonna lay down to the side, and then I get the middle of it. So each ball is on my spinal extensors, and then the middle is not putting pressure on my spine, so it's not irritating me. When you do a foam roller, it can be irritating because it's pushing on the spinous process on the spine. So I just breathe and relax. My knees stay bent, chin tucked, breathe and relax. And then now I'm gonna take 5 breaths right here, and then I'm gonna shimmy my body. I wanna lift my head up. I shimmy my body down about an inch, and then I chin tuck, knees stay bent. If I straighten my knees out, then my back starts to tilt, my pelvis starts to tilt, and so I lose some of that pressure I just want to keep my knees bent so I can keep the pressure on that double lacrosse balls. And then I'm going to shimmy down. Remember, 5 breaths at each spot. And so I'm going to end up about mid shoulder blade in the 3rd spot, taking 5 breaths, thinking about sinking down into the balls each time, 5 breaths, and then I'm done with that one. Let's get into number 4. Now we've loosened up the muscles on the front of the hips, on the back of the hips, and in between the shoulder blades. And so now we need to use those muscles. So first thing that we have to do, we need to fire up the glutes and the hamstrings. There's a chain of fascia and muscles that are connected all the way on the back of our body. So what I want to do is I measure, just imagine this is a wall. That's the easiest way to do it, is like I do it against a wall. So I measure my foot length away from the wall and then go shoulder width. My face stays in line with my chest and I reach back with my butt. It's a backward and forward motion with my hips, and my lower leg stays vertical. So I'm gonna do the same thing against the chair right here, thinking it's a wall. I touch and I come back up. This is a really challenging exercise for clients to do in the beginning. It typically takes 2 to 5 sessions to teach them this movement pattern. It's one of the most important things that we learn if we want to prevent a lot of injuries from coming back long term. We've got to get this hip hinge down. So I'm right here, my face stays in line with my chest. My butt, I'm pushing it back to my butt bones to touch the wall or the chair. I push my hips forward. I push my hips back. You can see that my lower leg is staying as vertical as I can keep it. I just don't want it wiggling around. And it really should not move forward. If it moves forward, now I'm putting a lot of pressure on my knees, my quads, and then my low back. I need to push my butt back, and it should not hurt your back at all. And clients are amazed when it doesn't hurt their back. And the great thing, this can transition into you're reaching back, and now I can reach back, push my knees out, and I can pick something up from the ground, and I'm not tweaking my back, right? So those pulled muscles in our back, we shouldn't be having problems with them. We do that for 2 sets of 15. So a total of 30 repetitions, because we're training that movement pattern. We want to make it unconscious where I'm using the hamstrings and the glutes. Let's get to number 5. Number 5, we're gonna get the scapular retractors, these muscles in between our shoulder blades. We need to get these fired up. We gotta take a lot of stress and pressure out of our upper traps. We've got to use, when we pull a muscle, we need to use that muscle a little bit. We want to get blood flow to it, but we're not trying to hammer it. We don't want to cause problems there. So we need to get blood flow and fire up these muscles right here. So we do these scap squeezes. So this is the scapula, our shoulder blades, and we squeeze them together, but we put some resistance on it. So right here, I'm going to grab this, this band. And so I'm gonna get my elbows right here up against my rib cage. My chin is tucked. I'm in a good athletic position right here with my feet somewhat athletic, right? So now I chin tuck and I'm pulling my shoulder blades down and back. I can come out really far. What I want is my shoulder blades to lead, and it's really my chest that's opening up. So you can see it from the side. My chest here is opening up, the shoulder blades going down and back. So I pull down and back with that chin tuck, holding it for 5 seconds. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Okay, and so I want you to do less of those. It depends on how much your tension is. This one's a really hard band, so I would do 2 sets of 10 with this. If you have a really soft band, do 2 sets of 15. It's always a good rule of thumb, just doing 30 repetitions and not going too heavy. So we fire up these muscles, so we're using them in between the shoulder blades, but it's really the form of how do I do it. I'm pulling those shoulder blades down and back, my palms are up, and I'm holding it for 5 seconds, just not rushing it. We're getting blood flow in there. So those are the 5 exercises. Now, the first one, we're loosening up the front of the hips, our hip flexors right here. So this is our major hip flexor. We dug into the psoas, right here, digging into our glutes. That was the second exercise. First exercise, digging into the glutes. Second exercise, digging into the hip flexors. Third exercise, we're loosening up in between the shoulder blades right here. and the rib cage, thoracic spine, getting mobility. And then our fourth exercise, we're loading up this chain, hamstrings and glutes, but it goes all the way up those erectors that we loosened up already. So we're getting a glide through those muscles. And then the fifth is those scapular retractors. We're getting those shoulder blades down and back and firing up those muscles. Make sure you hit the subscribe button and leave us a comment. Let us know if there's a specific problem that you're dealing with. You want us to do a video on it. We'll show you exactly what we do here in the clinic that fixes our clients. We'll see you in the next video.